Now, the Kenya Medical Supplies Authority, Kemsa, appears headed into turbulent clouds brought about by, by pending bills.
Barely a year ago, the State Medical Supplies Agency underwent a major management purge following corruption allegations famously known by the name of Covid millionaires.
Indeed. Now, the new management is now facing financial challenges arising partly from the failure by counties to pay their debts, amounting to, get this, 2.8 billion shillings.
Kemsa CEO Dr. Andrew Mulwa says despite the reforms being implemented, the authority is living from hand to mouth, with suppliers piling pressure over the debt burden.
A walk inside Kemsa's warehouse at the authority's headquarters in Nairobi. One cannot fail to notice empty racks and half-filled shelves. It is clearly evident Kemsa is facing serious financial crisis. The genesis is traced back to irregular payments made to connected suppliers during the Covid-19 outbreak. The Covid-19 scandal resulted in the loss of 7 billion shillings.
The Covid-19 issues depleted our capital by close to 4 billion. Beyond depleting the capital by 4 billion, that is loss by 4 billion. We have now what I was talking about, items that are slow moving or are not required. You have 2 billion that it cannot be cash, cannot be turned into cash.
Kemsa appears to be sinking further down the hole of financial turmoil. 90% of its business relies on selling medical supplies to county governments. But the county governments have not been paying their debts. The 47 counties owe the authority over 2.8 billion shillings. Kilifi County tops the list of defaulters with an outstanding debt of 275 million shillings. Nairobi follows with a debt of 243 million shillings. The other counties in the top 7 defaulters list are Tharaka Nithi, Homa Bay, Kakamega and Machakos.
When money goes to the county receives, let's say, 2 billion today. They have not paid salaries. They have not paid some other suppliers for critical items, electricity, what. They are likely to prioritize those ones than Kemsa. What we would ask is the counties to prioritize payment to Kemsa.
The enormous debt has thrown Kemsa into a cash flow crisis. The medical supplies body now relies on the equally unreliable weekly cash collections.
We are living from hand to mouth. Whatever collections we get in the week, we prioritize paying the suppliers. In that week, we get broke again, wait for new funds. We are living from hand to mouth.
Homa Bay Governor Gladys Wanga, whose account was suspended by Kemsa over bad debt, says governors inherited pending bills from their predecessors and that the challenge comes in when Kemsa deducts funds for fresh supply to cover the outstanding debt.
Every medicine that we have bought within this regime, we have paid for everything. So the bills, and we have also paid partly the bill that we found. Sometimes when you pay Kemsa, they take it for the old debt. So many times you have, like for example, Homa Bay paid, and after we had paid, they said, no, we cannot supply you because we have used it to settle your old debts. So many counties have looked at what other alternative suppliers they can get.
Governor Wanga, who is also the vice chairperson of COG Health Committee, says they will engage with Kemsa on a repayment plan, but also called on the authority to improve their order fill rate, which is at 50%.
So long as we can work on payment plans with Kemsa, we are able to clear in small bits what is outstanding. And then Kemsa can use what we pay to raise their refill rate so that we are able to find them all the medicines that we require from Kemsa. Because our first option for purchase of commodities is Kemsa. But if the refill rate is low, that's when we go to other suppliers.
Kemsa has appealed to the National Treasury to release 1.5 billion shillings, which was part of the 2 billion shillings allocated to the authority by the National Assembly in the supplementary budget. Kemsa has so far received only 500 million shillings, which was used to pay suppliers to restock.
Once the 2 billion comes, I can assure you, Kemsa's problems will be over, because the net deficit will be about 1.3 billion. And that is money realizable within 2 months.
The Kemsa management is now placing hopes on the implementation of reforms at the authority, which included reducing the number of staff and cutting on cost of transport. Kemsa has saved over 500 million shillings in operations. But even then, the 2.8 billion shillings hole remains wide open, further weakening the prospects of a quick turnaround for Kemsa.